When people talk about smoking, they often focus on cancer or heart disease. But for women, one of the most overlooked risks is fertility loss. Smoking doesn't just affect your lungs or hormones, it can interfere with your ability to conceive, carry a healthy pregnancy, and even affect your reproductive organs permanently. Let's break it down step by step. In women, fertility depends on several tightly connected systems: ovaries, fallopian tubes, uterus, and reproductive hormones like estrogen and progesterone. When you smoke, the chemicals in cigarettes, especially nicotine, cadmium, and polycyclic aromatic hydrocarbons, PAHs, start disrupting these systems at a cellular level. Here's how. First, these toxins damage the ovarian follicles, which hold your eggs. Unlike men, women are born with a fixed number of eggs. Smoking reduces this reserve faster, meaning fewer healthy eggs over time. Nicotine also lowers the body's estrogen production, which is essential for ovulation and maintaining a healthy menstrual cycle. Irregular periods, missed ovulation, or shortened cycles often appear in long-term smokers. Cigarette toxins can impair the fallopian tubes, making them less able to transport a fertilized egg. This increases the risk of ectopic pregnancies, where the embryo implants outside the uterus, a life-threatening condition. Smoking affects the endometrial lining, the inner wall of the uterus. A thin or unhealthy lining makes it harder for an embryo to implant successfully, which increases the chances of miscarriage or failed conception. In IVF treatments, studies show that smokers often need higher doses of fertility medications and still have lower success rates compared to non-smokers. Lastly, long-term smoking is linked to early menopause, meaning the reproductive window can close several years earlier than expected. Every cigarette damages the reproductive system silently, often long before any symptoms appear. According to the Indian Council of Medical Research, ICMR, and studies published in the Journal of Human Reproductive Sciences, smoking in women is strongly associated with reduced ovarian reserve, increased risk of early menopause, and lower IVF success rates. In India, studies show that female smokers may reach menopause up to 2 to 3 years earlier than non-smokers, and face higher rates of infertility and miscarriage. Most women don't notice the impact until they try to conceive. You may experience irregular or shortened menstrual cycles, difficulty getting pregnant despite regular attempts, higher risk of miscarriage or ectopic pregnancy, poor response to fertility treatments, mood changes or hormonal imbalance. Even if your cycle appears regular, the internal damage to egg quality and hormone balance may still be progressing. If you're planning to become a mother, or just want to protect your long-term health as a woman, now is the time to understand what smoking is really doing to your body. Subscribe to this channel for science-backed insights that empower you, not with fear, but with facts. Because the sooner you know, the more you can take control.